is very much required, and careful disbursement because we are in the loan section. So basically, it is all the more important that how do we do it and how well we can do it. So welcome again. And on the panel, basically, we are having Mr. Bhaskar Gupta. You will be joining online. Actually, already online. He's already online. Welcome to you, sir. And I think you are with us and you are being able to hear us very clearly.
Yes, yes. Very clear.
Great, sir. Great to have you with us today. Because I think this time is a little bit odd time for USA. He is in Lucknow. He's in Lucknow, I think. Okay, great. Because he is very well, best of I thought that early morning he is fine. Great, sir. I'm sorry for this confusion. And basically, now let me just tell you something about Mr. Bhaskar Rao.
Bhaskar Gupta.
Mr. Bhaskar. There are some hiccups basically, and this is not a mistake of the technology. Okay, this is a human error. Okay, so Mr. Dr. Bhaskar Gupta, with nearly 2 decades of experience, a distinguished radiologist who serves as a director of Suvidha Diagnostics in Lucknow, renowned for providing a comprehensive array of diagnostic services, including ultrasound, CT scan, X-ray, managing a team of around 20 skilled technicians. He has established his clinic serving its diagnostic services to more than 100 patients every day. Dr. Bhaskar Gupta passed his MBBS in the year 2003 from renowned King George Medical University, Lucknow, and did his post-graduation in radio diagnosis and imaging from the Reputed Institute of Medicine Sciences, Banaras Hindu University, Varanasi. Besides the medical profession, Dr. Bhaskar is also an avid fitness enthusiast and a marathoner. That's great to know, sir. And most welcome to our panel discussion. And it will be really a great experience for all of us. I think this is for the first time we are having this kind of an interface. So now I will request all the panelists to just give your views first, and maybe we can further go for elaborate discussions on digital technology and its impact on business and management practices. I would request sir to start the panel discussion.
For me, because I am heading the management department, so I will be telling you how you can use the technology. It is not I who is telling you about it, is my student who taught me about it. For a management student, a management institute, I think more than an input, output is a very important part. I think every management student has a dream that we should have a very high or decorated package. You are agreeing with me? Yes or no? So my points are use technology for that. We'll be having n numbers of things where you can upgrade your skills. So technology is giving you a chance where you can upgrade your skills. The platforms in which you can upgrade your skills, there are n number of platforms which you can use it out. Because ultimately, goal of a management student is if he is getting a good package, then he will be happy for that. The number one platform which you should use it out. I think it is a LinkedIn platform. How many students have their LinkedIn profile? 2, 3, 4, 5. Okay. So now give me a promise that you should have a LinkedIn profile. Yes or no? So the point is how you will use the technology for your upliftment of the career. So one, you will be using the platform for getting more exposure to the employers. Then coming to the skill part, you should learn the skill from the technology also. There are any number of platforms where you can upgrade your skills. For example, if you want to become a global leader, then you should know many languages. It is not only that the English is only one language. Now the globe has become a new country. So there are any number of languages that you can learn from the technology. I think you should know French, you should know German. So that is the way the management students should think about. They should think about how we can use the technology for the betterment of things. Now coming to the third part also. For example, I am not against of the using the chat GPT, but using the chat GPT in the right manner, that you should also understand that. Let me give you one example. We were in the workshop of the resume making workshop. We do that kind of workshop so that you can make a resume. So we have given the assignment to the student who can make your resume. So one of my smart students, he have given the chat GPT and he have made the resume. So I have seen the resume. Now I have asked the question, okay, इसने बनाया. So मैंने बनाया 100%. Okay. So my first question was, there is one topic which is known as career objective. लेकिन तुमने लिखा है, हाँ. मैंने कहा, okay, now tell you what is your career objective. And then he was blank at that. So it is, if you are using a technology, use it with your brains. It is not only that you use technology for only making of using of technology. Writing an answer from a chat GPT is a smart one, but understanding the chat GPT answer is also smart. Because the professor who is sitting over there, he knows the caliber of the student. If he is writing the value answer essay is written over there, he can understand whether he is written or not. He will give you the number, or he can read the number also. So the management student, because the world is changing dynamically. Now the India is not a country, the globe is a country. Because anything that happens in China will give an impact in India. Anything happens in Ukraine, it will give an impact in India. So the globe is a country. So upgrading your skill is the biggest challenge for you people. So for upgrading your skill is the biggest challenge. Now for upgrading the skill, technology is only a tool where you can upgrade yourself. It is only we have seen a robot and then we have seen Chitti 2.0. Now you should take a version of 2.1, 2.2, 2.3, and it is only the technology will help you all of that. So that is my take. You should use the technology, but it is only within proper brains also. So what ma'am has told us in starting, the technology should be as using with brains. It is not only only using of technology you use it like that. That is my take on that.
Thank you so much, sir. Yes, now in request, sir.
Yes. Once again, Manoj Panda here. I am basically from the healthcare background. I am exposure of 24 to 25 years. I am always happy to be speak something in front of you. Just let me back to the 1990s. Before start saying anything, sir has told कि marketing वाला है तो अच्छा बोलना पड़ता है. It's not like that. It's how you have to present in a very simple और दिल से दिल कनेक्ट तभी आप कुछ कर पाओगे. It's not only technology or upgrading something. Yes, we are in the verge of in the digital era. We have to learn something new. In case of, as I am from the scientific background, so I will tell something about the healthcare industry, something about pharmaceutical industry. We all are linked. Like I just my colleague is from and not from SDFC Bank. We all are linked in marketing. Whether you are working in financial segment, whether you are working agricultural segment, in the management I am saying, not as a teacher or professor, in the management thing. Let me ask you one something. Which is the best era or generation? 1980 or 1990 or 2000?
1990.
Yes?
1990.
1990. क्यों?
They were the fourth generation.
Very good. So, इस credit goes to you. ये आंसर कभी मिलता नहीं है. Why 1990?
They were the fourth generation from 2000 and 1980.
Yes, from Belgadi to aeroplane. I am the luckiest one. 1976 birth year. So I will say I am the luckiest one. So we have seen that transition in the generation. From Balgadi to rickshaw to motorcycle, from different type of motorcycles, then we have hexagon, then we have car, everything has changed. So this is my point. Any segment, wherever you are, you will placed in that group, whether you are working for healthcare, financial, banking, anything. Like ma'am has just described in his presentation, we have a new thing coming in our healthcare industry, and let me speak very openly. We are in a very odd position whether we should accept the digitalization to our healthcare or not. Because healthcare is very different. It's not like phone. You will just Google it, who is the best doctor, who is the best cardiologist in the town, और आप शुरू कर दिए अपने मम्मी को लेने के लिए उनको दिखाने को नहीं होता. Because Google has its own ratings. There are many third parties, those who are doing. Dr. Anuj Panda is the best doctor. I may not be. So now, being a executive, being a manager, whenever you are implementing the new things, always search it. Always search it. I am not against of any search engines or digitalization. We are using at present. This is the industry, healthcare industry, जो कि अभी तक पूरी तरह से डिजिटल नहीं हो पाया. Because I have that little experience. I have started my career with Medanta, one of the biggest hospital, I will say, in the Asia Pacific. Then with Yeshua, then with AIG, now with Balaji. So we are also getting immense pressure from our management team कि आप digitalization पे ज़्यादा काम करो तो generating more and more pressure. But being an experienced person, it is 50-50. You have to work in the middle. You have to see the needs of your segment. Like if I am promoting robotic and I will go to the bankers, I will say how much it is costing. Then the third party from the LG company, he will say, sir, 3 crore का पड़ेगा. It almost costing 3 crore, 4 crore, 1 crore. Any X number. But is it my need? Or I can operate through laparoscopic also. Whether my city has that much equipped that we can use robotic, whether my doctor is that much ready to use the new generation, or just for the status symbol. So my point is that use 50-50. That depends totally on your industry, your focus area, and all depend on your mindset also. So just see your need. That is my point. Thank you.
Right, rightly said, sir. Actually, my point is also connected to you. See, just elaborating what sir said. I am also from the era like 1974. So we have seen the transformation. But like Belgadi said, aeroplane done. But again, if you see, after Belgadi there was cycle. Then we moved to car. Now we are going back to tricycle. All are riding. Because the transformation which has happened has affected human life. So when you talk about digital technology or any technology, first most important thing is the human connection, the human part. And when we, as human beings, we have a problem, we don't learn to say no. We don't know how to limit things. Or basically we are more like require comfort. Comforts make us more trouble in life. The troubles in life is because of more comfort. So when you talk about technology, technology has two parts, like all the panelists agree. This is blessing as well as this is positive and negative aspect of it. You have to understand the negative aspect when you are using technology. I will tell an example like we are from the education side. There will be a lot of transformation going on in education. A lot of people say that why you require a building, why you require a building to have an education. There will be no buildings. You will have reality VR की बात करते हैं, virtual reality की बात करते हैं. Like post corona and pre corona has got a transformation in digital technology. Before like 2020, rarely we used to know that there was an online classroom, online platforms. How many of you knew that there was Zoom? 2019, one of the person from industry called me that we will have a Zoom meeting. I was surprised what he's saying. Zoom meeting is what? But Corona gave positive. There was a positive of Corona also. Corona taught us how to use Zoom, how to use Google, and Google also came up because Zoom was ready at that time. And because of that, now we know what learning as learn from anywhere, from anybody. Do you require a teacher to teach you? And when we talk about augmented reality, the teacher will come and there are robots who are going to teach artificial intelligence department. But keep in mind, there is a difference between AI and NI. Natural intelligence will be there and AI cannot replace natural intelligence. How it is going to impact and tell you. See, when you come to this campus, are you only coming for learning? What learning? This is subject आपको YouTube पे मिल जाएगा. You get all the contents online. There are a lot of human connects which happen. A teacher connecting to a student. Institutions were called the value-driven, value-imbibing institutions. अभी कुछ समय बात कर रहे थे आज के जनरेशन में वैल्यू सिस्टम की प्रॉब्लम है, एटीट्यूड प्रॉब्लम है. So like if you call a school, why you go to a school? A lot of people will say, do you require a school? All the things which is taught in school is available online. There are a lot of online platforms. A student attends, give an exam. Just he has to give an exam, he will be qualified. He can progress. But why does a student go to the school? The teacher used to teach. Guru Shiksha Parampara जो बात करते थे Indian culture में, that we are going to miss it. The connect we are going to miss it. Today, Monica Madam is here. The relation which we have like a classmates is totally different. This bond is because we were classmates. You're sitting here, you have a bond because you're classmate. Now you talk about a virtual reality classroom. How many of you have childhood friends? And childhood friends are maximum school friends. The bonding you have with the school friend cannot be built when you are in a professional world. Think of a generation where you don't have, they have used technology to the maximum, and now they don't have friends. You have to understand how we as human beings are creating problems for ourselves. Today the biggest problem is loneliness. Who created the problem of loneliness? This is we who have created the problem of loneliness. I was telling somebody, like we were discussing, so I said today the parents, I'm just deviating from the technology part to the family part. Today maximum parents, हम तो हमारे थे, and now the generation is coming, हम तो हमारे एक. And there is a generation who is going to marry. Why marriage is required? Now think that child who is alone, he marries a girl who is alone. उनके जो बच्चे होंगे, do they have any relation called mama? Do they have any relation called chacha? Do they have any siblings? No cousins. And you talk about a bimari called depression. Depression, we never used to listen to depression in our time. That is why Sir was saying we are lucky generation. Depression over that we used to get those projected depression was over. Because we are using technology. And because of mobile, we are connected to the world, but we are not connected to our neighbor. And we are becoming lonely. And then we have doctors who are treating depression. I did psychology because I know that coming generation there will be a problem, and that has started counseling, depression. And I will start counseling and do a business. There is a business opportunity which I am getting because People are using technology, people are creating problems for themselves, and we are creating because we don't know limit. Because basically human beings are lazy. And we all require comfort. We use technology to make our life comfortable and create problems for ourselves. See, technology has grown because this technological generation, industry 4.4, 4.3, it has given a lot of blessings. If you talk about agriculture, if you talk about prediction of weather, you talk about a lot of healthcare, you talk about marketing, connecting to people online, that has given a lot of things, but we have to understand how to use it. And the problem is we are not learning how to use it. So when it comes to education also, today if you see online education, everything is not right in online education also. So there is a connect which has to be there, and if we understand that connect, the things will be better. So my say is use technology to the limit and learn saying no and having a balance of everything. And health, like we call economics, society, social and environment. And the most important is our own health. That is most important thing, then only we will have a happy life. So considering our happiness, considering because we in India talk about GDP, and everybody is fighting to have GDP. Like country like Bhutan is a country which has got GNH, gross national happiness, and they have said no to a lot of technologies, and they are the zero carbon emission country, and they are suffering because of the neighboring countries. They are creating issues for them, and they have learned to say no to a lot of things which creates problem to the environment. So we have to learn from countries like Bhutan also, how to use the things and limit ourselves. So this is what I wanted to say.
Thank you so much. A great discussion going on, and definitely we are getting enlightened by it. And I'm happy that students are also participating. So that's a real thumbs up thing. Cheer up. And I request Deepika sir to now give a financial commercial outlook towards the digital growth.
Good evening all. Before I start, I want to say that I am applying for the please myself to talk the speaker because I have never participated in any kind of creative like avoiding drug record. Now the topic is impact of technology on a particular sector, say education or in my case financial services, and the management practices in that particular sector. Now, when we speak about impact, we are definitely having a comparison. You cannot speak about impact without comparing. If I speak about my industry, banking and financial services, we have to go back in time a bit, and if I have to segregate this timeline, I'll be segregating it pre-1950 and post-1950. Why? I don't know. I mean, simply having a does anybody know why I kept 1950 as the separating line? See, 1950s was the time when the computers were introduced to banking. Before that, it was all spreadsheets. It was all tables. It was all list of people. It was all debit and credit written on a piece of paper or a register. Right? Every information was getting recorded with a paper and on a paper with a pen. What was the aim of including a machine such as a computer into banking? See, banking at that point in time was an industry which was based on human contact. So what was the reason for introducing a machine which avoids human contact? The purpose of introducing computer was to give more time to humans and less time to routine work. At that point in time, the computer which was introduced was the basic function of that computer was to read the checks. By that time, magnetic MICR, are you aware? Mom may be aware about MICR. What is MICR?
Magnetic character.
Right. So that was a method with the help of which you have to, at least write down each and every detail of a check. That code, which was stored with the help of a magnetic ink, used to be good enough to record all the details of that particular check. At least the location, the branch name, and all. So that gave more time for the people in the branch to interact with you. So here it aided in developing the industry. If you are giving more time to the person visiting the branch, probably you will be getting more business. Between 1950 to 1960, there were hardly any changes. The only big change that came was in 1960s when ATM was introduced. And you'll be surprised, the first ATM was introduced in 1967. In 1960s, probably people might say 90% of the population might not be aware of this machine. But it was introduced in London by HSBC. They had an ATM machine which could dispense cash with the help of a card. The card was there. There was a card, and it used radioactive material for this. It was harmful for the humans, but then it was using very less. The quantity was very less. The radiation was very less. So ATM came into existence. That was the major change. What was India doing by then? Indians actually got ATMs in the year 1987 or so. 1980. Again, the first ATM machine probably was in Bombay. It was installed in Bombay. So we were 20 years behind the world. Now to 2023, probably we are the most stable banking industry in the whole world. We have survived shocks which no other industry, no other country could have survived. Why? We used the technology all right. We got it late. We started using it late, but we used it right. We actually did not forget the basics. We did not take a plunge directly into the consumerism. We actually, we actually did not alter the basics what our ancestors had taught us. I don't know how many of you might have been taught there is a funda which actually was taught to our forefathers about how much money should be kept as a saving, how much should be given away, how much of it should be spent. Those fundas are still there inside our genes, so probably that helped us to survive those shocks. But then today we are using the best of technologies, and still we are, safeguarded from the bad effects of those technologies. What are the technologies which are being used today in mining industry, and what are its impact? Probably that would be of, the history probably might be boring to you, but then the current day technology might be appealing to you. So all the the buzzwords are there in our industry too. AI is there. Can somebody cite an example of how AI is being used in banking and financial services?
Credit risk,
Credit risk.
Credit risk, no, credit risk, see, credit risk, AI, ठीक है, but then is not the direct example. आज की डेट में AI का कोई
Chatbots to chatbots.
chatbots. Chatbots can be, they are being clubbed with, they are RPAs, you know. This is robotic process automation, what we call. And clubbed with AI, now they are providing solutions. Earlier they were only answering it yes or no and giving you some options. But now clubbing them with AI, they will be probably serving you as a human kind of see can be developed with the help of them. But then again it's a far cry. Very soon you'll be getting 10-second notes with the help of a chatbot. 10-second notes, only personal notes. 10-second notes will be personal notes. Project notes definitely will take time. Jokes apart, technology is going to. Acha, we are all speaking about technology and how it is impacting the thing. Have you ever wondered if almost everything is getting automized? Where will be the role of a human being be? I mean, where do you see yourself in this whole gamut of machines and systems in place? See, that is the question that we people should be looking at. So, and I'll go back to this presentation. You need to understand technology because only then will you understand, you will be able to understand your role of driving this technology. See, I sell home loans, I sell mortgages, I assess the income part, I disburse loans, and I'm telling you, whatever I am doing, almost 60% of this will be automized in coming 3-4 years. I mean, today I ask a person to come to my office, sign the loan agreement. That loan agreement needs to be filled up at various places by hand. After the signatures, the title documents need to be captured on the system and they need to be kept in a docket, and then the whole thing needs to be transported to a vault where a person actually receives it, and before transportation there is a lot of other activities which need to be followed. All these things are going to be automized. Probably we will not need any title documents to create the mortgage. We will not need any signatures to create the list on system. Probably he might not even visit the office. He'll sit at his home, give a biometric authentication, and the money will be transferred to his account not so soon. It is going to happen. No. But see, today the only risk, the only reason why it has not yet been done are the laws which were framed long back. The Banking Act is 18th century Act. 1880 में बना था. So a lot of revisions, a lot of amendments need to be done before all of these all of this can be rolled out. किसको पता है अपना पहला बैंक कब खुला था इंडिया में? 17th century. And it failed. क्या नाम था? Bank of Hindustan. The oldest surviving bank, very common answer. Oldest surviving bank of the country. It is very inside. State Bank. State Bank of India.
But they are transformed.
हाँ?
They are transformed.
See, उसकी भी एक स्टोरी है. 18th century में 1840 में a bank was formed by the name of Bank of Calcutta. उसके बाद एक बना बैंक ऑफ मद्रास, फिर उसके बाद बना बैंक ऑफ बॉम्बे. और after working for a few decades, they came to know that you need to have a nationwide presence to survive. So they all got together, formed an alliance, and they called it Imperial Bank of India. And it functioned as a quasi central bank also. Means by that time RBI was not in good place, so it functioned as a quasi central bank for a long period of time until probably 1940 or something, when nationalization happened. It was named as State Bank of India, and since then it is. So State Bank of India can be the oldest surviving bank, or 18वीं सदी से अब तक सर्वाइव कर रहा है. HDFC भी बचा है, 1990 में आया.
I thought your branding is.
अच्छा, if I had to brand,
Yeah.
Thank you so much. I'm really happy that different perspectives we are getting now. And we have one panelist who will be joining us virtually. And we are eagerly waiting for that. That is Dr. Bhaskar Gupta. I think Dr. Bhaskar, you must be enjoying the panel discussion until now. And basically, now the new dimension, how the what changes you are observing now, and in future, how do you see the technology is going to help our humanity in totality? Okay, so welcome to the panel, sir, and we are eagerly waiting to listen from you.
A very good afternoon to everyone. I would like to thank the Psbe Institute of Management and the organizers of today's conference for giving me an opportunity to give a talk on this topic. Am I audible? Am I audible?
Yes, you are audible. Immediately.
So the technology has brought about changes in every industry, and the healthcare industry is no exception. With the world reeling under the COVID-19 pandemic, most countries are following lockdowns and social distancing to curb the spread. However, with the help of technology, remote consultation with experts, and the availability of mobile apps have helped non-COVID patients to receive improved patient care and quality healthcare experiences. I have tried to summarize the impact of technology in healthcare in few of the following points. Number one is improved communication. With emerging digital technology, healthcare has facilitated improved communication with the healthcare organizations. More and more medical professionals are leveraging technologies such as audio, AR, VR, and real-time meeting capacities and other online platforms to communicate and help spread knowledge in the field. Also, teleconferencing has made communication beyond geographic borders a breeze. Another important aspect is on the medical record keeping. Gone are those days when we keep bulky files and worn out papers. Now, with the digital record keeping system, we can save summaries of medical patient and their lab reports, diagnosis, their surgeries, their prescriptions, and of their hospital stays in a very compact manner. And this allows us to bring a better insight into patient's health, leading to accurate diagnosis and better patient care. These digital records can also be shared amongst specialists, improving better coordinations. If properly maintained and implemented, digital records can help increase accountability and reduce medical negligence also. Another big challenge with this, with usually with our medical profession is the keeping big data. Now, big data refers to large amount of data that is very complex and difficult to process using traditional methods. This digital technology allows medical accountant to gather big data in a short time. Data collection helps healthcare professionals to understand and learn cutting edge techniques and trends. The data can be used for analysis and making prediction about the possible epidemics and identify the risk factors. Also, this big data allows clinicians to recommend appropriate preventive steps and more effectively and to reduce deaths and mortality. This data also ensures in improving efficiency and accessibility with less wastage, leading to better research and development of newer medical treatments and life-saving formulations. Cloud storage is a secure and cost-effective solution with backup and recovery features that are managed and maintained without additional server hardware. And it is an invaluable advantage for medical research analysis that help in efficient health information exchange also. Coming to the other point is information and communication technology. Today, approximately 70% Indians have mobile phones, and most of them use it to access information of some kind from the internet. Health technology also has reformed its processes to connect with the people efficiently. This digital technology has linked not just medical professionals but also with the patient. From emails, telemedicine to smartphones and telemonitoring system, all are used to share information. This is particularly useful for rural areas facing a dearth of facilities in the form of specialists and machines. From diagnosis to management, this information communication is improving constantly and streamlining how the healthcare industry functions and how patients are communicating with the care providers. Another aspect is improved patient care. Digital technology in healthcare has provided the healthcare community with advanced tools to improve patient care. Physicians and doctors can easily assess the complete medical histories of a patient and make an informed decision. Physician can also use apps to identify possible medication error and help a patient's safety. Now in the market, as you must be aware, we have a smartwatch from Apple, which can do real-time ECG of the patients. And the concerned physician or the cardiologist can be informed at the time of any mishappening. VR devices and apps are also there to ease symptoms and anxiety and depression in older patients and those suffering from mental illnesses. Augmented reality. Augmented reality also helps surgeons to perform complex surgeries. Especially the robotic knee replacement, other surgeries are going to very help with this technology. Now we have also have very smart health apps, which are all because of digital technology. These apps can enable patients to take access a quick and accurate medical information using their smartphones. Patient can use these apps to track medical appointments, receive reminders, and even access to test result easily. Now, gone are the days when patient has to come to the lab for their blood testing. With these health apps, patient can order online. The collection can be done at either their home or their offices, and the online report can be provided on their phones. Physician can also use these apps to assess drug information to prevent side effect, solve any issues, and improve diagnosis. Physicians can also communicate with their patient directly, record their vital signs, maintain logs about consultation and visits, and achieve better procedural efficiency. And lastly, I like to discuss the topic of telemedicine. Telemedicine is a medicine which allows patient to consult with a specialist anywhere in the world. The new technology in healthcare facility and critical care in emergencies and potential life-saving tool. Telemedicine help patient to access telemedical devices to receive home care and support via apps and video calls. Telemedicine makes it possible to transmit biosignal, medical images, and other crucial information to specialists through asynchronous consultation. It means neither the doctor nor the patient has to be present or online at the same time. This can significantly reduce the waiting time for patient and help improve delivery processes. So I think this is all about the digital technologies and its impact on medical health. And post Corona, post COVID, it has drastically changed the way we practice.
Thank you so much, Manthan. Thanks for being with us. And our human interference is reducing as the technology is advancing. So, in medical field also, when we talk of robotic surgery, and do you think people will be comfortable going through that process? Because human interference we are used to now. So, these are the million-dollar questions which are there in the minds of each and every one. And I think slowly we have to adopt the technology in the medical field when it comes to critical treatment of the critical illnesses. But thanks a lot for giving us an overview on the steps and remedial steps which one can take by using the technology. So thank you so much, sir, and we would like to have you with us here also in Brisbane College for your offline lecture where we can meet face to face. And it is really wonderful because now when we talk of technology, the very important thing is there is something called emotional intelligence. See, we are having this intelligence available to us in the form of technology. But the human factor definitely is equally important. And that is one part which is we are going to miss. And this is going to change our perspective when it comes to developing relationships with each other in the professional field as well as our personal life. That we are already seeing the initial impact of it. And over a period of time, I think, जैसा समय कहा कि हम लोग सब अकेले पढ़ते जा रहे हैं धीरे-धीरे, है ना? So that part is also happening. So in business, it is also reflecting in different ways where disbursement of loan is there, community imparting education is there, and medical care, even in the teaching. So things are changing drastically, but we have to adopt it and somehow we have to get used to it in a better way. So post COVID, we have definitely learning how to use the technology in business as well as other activities. So I think among the audience, if you have any question, I would request you to ask that question to the panel. Anybody from the students, you have gone through the entire discussion process. कोई सवाल आपके मन में है तो डेफिनेटली सर आपसे एक सवाल शुरू करेंगे.
My question is to the whole panel and specifically to Anchor. Like all the technologies which are coming up nowadays, in a way we feel that they help us to serve masses because earlier the businesses were limited. Not everyone was having an account in a bank. Banking services were also limited to the limited people. All other facilities, even to education, to the healthcare, everything. Now, since we are developing and progressing, we are serving crores and crores of people. We want to reach out to everyone. And here technology helps us. It helps us. But at the same time, it makes the contact with the machines. The human interface is going on the backside. It's a challenge now to management professionals and people in all the industry how to make both the things happen. We should reach out to the masses as well as to develop that contact because As far as banks, if I take an example, we are visiting the branch very less. We are
several years in same class. So I have selected a topic which is related to the business side, that is exploring the evolution and impact of digital transformation in the traditional business unit, that is production, distribution, and trade itself. That has got a tremendous digital transformation nowadays. And this digital transformation that has been in the form of application of technologies like Internet of Things, artificial intelligence, cyber physical systems, and they have all resulted in a smart market. When we say smart market, what does it mean? It means the rate of communication transmitting from one place to another place. That is the consumer connect. And individual consumer can be connected with the help of these digital technologies. That is called the smart technology, smart market. Is self-monitoring. Nowadays, the days have come where the monitoring was required by supervisors. The monitoring as well as diagnosis of issues. They are being taken care of by artificial intelligence, robotics. And this has increased the level of productivity, quality, as well as customer satisfaction. This is the result of digital transformation. Now we know the production process consists of many producers, consumers, and providers, service providers. Now these platforms has been connected very much and very effectively by digitalization. Now what is the after effect of this digitalization, of this connection of these platforms? That is, there is a continuous and consistent flow of communication from one place to another. The feedback is not required nowadays. It is real-time communication. So this is the strength of digital transformation. Now this customer satisfaction is the bottom line of any business. When cities are going to the market, then the main thing which will be required from you, what is your output? And your output is demanded today in the market, not the traditionals. And this, on this background, the digital era is the outcome of innovation and adaptation. Because if you are arrangement in the business, then there are two aspects. These innovation is based on the entrepreneurship. If you have got the innovation of entrepreneurship, then you will be inclined to do the innovations. And these two factors, they will be culminating into the advanced technologies. So this digital transformation help in the business to grow and making it more competitive. Now I have collected out certain researches, and the background and methodology of this research is that is the I have got an objective of what is the conceptual framework of marketing and what is the role of digital transformation in today's marketing sector. That is my first objective. Then what are the different technological enablers and innovations in smart marketing? Now this third objective is specific challenges and opportunities by the application of advanced digital technologies, factors and tasks to bring the process of digitalization to a successful conclusion, and phenomenal leap in the marketplace through digital transformation. Now the research methodology which I have adopted is the qualitative interviews, because I have been working in realizing plans to have selection. How is the digital transformation is taken like such and I will take a personal interview of the key persons of realized on continuous every month. I am talking to them and I structure a format of questionnaire, and this is the qualitative assessment. Then I have taken So this is the step that is, it has improved productivity. This is the first research slide I have undergone. This how it has basically coming from it is you can see condition-based manipulation. That is the proactive action that is being taken by the engineers and the system itself. It is based again on the internet, the artificial intelligence, and the hardware connections of computer. So these are the things which is giving benefit in the maintenance of the equipment. And what is the this? Because this is reducing two things. That is reducing the failure of the equipment before the failure takes place. This and this again is making a scheduled delivery of the product at the consumer end. That is the essence of this service. Now, the second as marketing is concerned, that is the customer relation management that is giving feedback to chief marketing organization. It is giving feedback on to production planning, and this is the nodal agency which is coordinating this marketing. Now then, I have taken the study of poor technology. Poor technology deliverables I have considered is on demand or poor technology is a very giant organization which is taking care of poor eats. There are two divisions, poor eats and poor transportation. So on hand, on demand transportation, the poor technology has got such a digitalization that even by using within seconds you will get a response from the taxi driver that it will give you the in minutes and seconds that he are. No, this is I have taken two parameters in case of Development Bank of Singapore and Amazon. But Development Bank of Singapore, I have taken Development Bank of Singapore technology adoption. The technology technology adoption, and second, in case of Amazon, I have taken the driving customer awareness and data-driven personalization. One of my esteemed participant, Mr. Gupta, has asked that what is the alternate of human touch. Now, friends, the human touch is going to be experimented by the digital transformation in the near future. There will be human touch one to one. Amazon like companies, they are going to exercise individual customer based personalization and delivery of the services and products. And it will be not far away. Within 2 years, that will be our practice. So, what are the outcomes of this analysis of Development Bank of Singapore and Amazon India? Data Development Bank of Singapore initiated shift towards digitalization by technology adoption. They adopted a mobile app that is called DG Bank app. DG Bank app, that is the branded name, and that is in-house development of their mobile app. And mobile banking with contactless payments. Amazon India focuses on user-friendly mobile applications, secure payment alternatives, resulting in different online seller, data-driven personalization, and evolving digital engagement channels facilitate to reach diverse customers. That is what I was insisting on. And digital transformation through artificial intelligence, machine learning, resulting in customized delivery and customized deals and the stops as per the preferences. Now, in conclusion, we can see that this research has given that certain findings that the advantage of digital transformation in pan-India marketing and warehousing network of PSB and meaningful impact on customer satisfaction. Significant technology investment. Friends, this is one of the contributing factors for the market share enhancement of say, particularly device demand. They have increased their market share in the steel industry, device demand by about 4 years. This is the step-by-step digitalization process which is taking place, and the device demand is a flagship company in SAIL for this digital transformation. And a huge project is going. And the students, I will appeal you all to see it, because Reliance Steel Plant has got a policy that they give projects to their students to carry out these digital transformation projects. So you can contact the authorities. Later there is another department for it, and they will cooperate. I think the Reliance Institute of Technology, they have got 10 or 15 students who are carrying out the project of digital transformation in Reliance. And I will give an example how this project is being carried out. Mr. Mohit Adar will be knowing because he is from the steel melting shop. So in converter shop, particularly I am talking about steel melting shop number 3. Now what they are doing, previously this foaming process that was, this is the metallurgical term I am using, that is called slag foaming process. Slag foaming is a natural process which occurs when there is oxidation of the carbon with the help of oxygen during the brewing process of steel. That is during the takes. Now, this foaming process is when the slag comes to the mouth of the converter, and it is still the rocking of the converter might be increased. Now,
So I cannot be silent about this. SAIL is actually changing its vision statement right now. They told after so many years being a public sector union, now we are into a new era. So we need to change trains, IAS, IPS. They are given this task to form the vision statement. That is going to be a major.
And to add to Madam's statement, want to say that management of United plan to establish a quite vision statement. They are demanding suggestions from each and every employee of organization. This is the first time it is being done. Digital technology, no physical solution. It is online, there is a portal, any employee can go and put his or her.
For the valuable time, suggestions, and the thoughts. It was wonderful. These have initiated further thinking. That is, was a very objective of these sessions. While listening to my answer my question, just one idea came in my mind. Maybe in future, you will be have two options. Either you will take the digital service or you take the human service. And human service will be at if you want it. Right now, if you book tickets online, they charge you service charge or convenience charge. Now, in the time to come, it will be reversed. If you do it online yourself, you will be given a certain discount. And if you want physical touch, then maybe you will be charged. Already implemented.
In UK, if you
Yeah.
have to visit a bank, you need to take a prior appointment. And as soon as you enter the branch, you are charged a certain sum. It is
Yes.
automatically deducted.
20 years back, so maybe.
Within-
And all the times are good.
PDR is giving discount on movie tickets.
Okay.
Online if you book.
Right.
Already it is started.
From Jan, Jean and Jan Jack, times are all good. We have traveled from Belgavi to flights. My daughter will say after some time that I have traveled from Earth to Moon. हम लोग यहाँ रहते हैं, वो लोग शायद वहाँ रहना घूमना शुरू करेंगे. वो अपने समय को अच्छा बोलेंगे कि मैंने यहाँ से यहाँ तक देखा. So all times are great and good. Thank you very much, everyone. Thank you.